Good morning, everyone. Welcome to our health show. I'm your host Amy. Today we're going to talk about diabetes, a condition that affects millions of people worldwide. Joining us is Dr. Jane, an expert in diabetes care. Welcome, Dr. Jane.
Thank you. I'm happy to be here.
Let's start with the basics. Dr. Jane, what exactly is diabetes?
Diabetes is a disease that affects how your body turns food into energy. When you eat, your body breaks down food into sugar, or glucose, which enters your bloodstream. Your pancreas makes a hormone called insulin, which helps the glucose get into your cells to be used for energy. If you have diabetes, your body either doesn't produce enough insulin or can't use the insulin it produces effectively. This leads to high levels of sugar in your blood.
What types of diabetes are there?
There are three main types of diabetes: type 1, type 2, and gestational diabetes. 1. Type 1 diabetes. This is an autoimmune condition where the body's immune system attacks and destroys the insulin-producing cells in the pancreas. It's usually diagnosed in children and young adults. People with type 1 diabetes need to take insulin every day. 2. Type 2 diabetes. This is the most common type. It usually develops in adults, but more children are now being diagnosed with it. In type 2 diabetes, the body doesn't use insulin properly, which is called insulin resistance. Over time, the pancreas can't make enough insulin to keep blood sugar levels normal. 3. Gestational diabetes. This type occurs during pregnancy and usually goes away after the baby is born. However, having gestational diabetes increases the risk of developing type 2 diabetes later in life.
What are the harms and complications associated with diabetes?
Diabetes can cause serious complications if not managed properly. Some of the major complications include: 1. Heart disease and stroke. People with diabetes are at higher risk of heart disease and stroke. High blood sugar levels can damage blood vessels and the nerves that control the heart. 2. Kidney disease. Diabetes can damage the kidney's filtering system, leading to kidney failure. 3. Eye problems. Diabetes can cause damage to the blood vessels in the eyes, leading to conditions like diabetic retinopathy, which can result in blindness. 4. Nerve damage. High blood sugar can damage nerves throughout the body, especially in the legs and feet, leading to pain, tingling, and loss of feeling. Severe cases can lead to amputations. 5. Skin conditions. Diabetes can make you more susceptible to skin infections and other skin problems. 6. Feet problems. Diabetes can reduce blood flow to your feet and cause nerve damage, increasing the risk of foot ulcers and infections.
That's quite a list. How can people avoid getting diabetes, especially type 2 diabetes?
While type 1 diabetes can't be prevented, there are many ways to reduce the risk of developing type 2 diabetes. 1. Healthy eating. Eat a balanced diet with plenty of fruits, vegetables, whole grains, and lean proteins. Avoid foods high in sugar and saturated fats. 2. Regular exercise. Aim for at least 30 minutes of moderate exercise, like brisk walking, most days of the week. Exercise helps your body use insulin more efficiently. 3. Maintain a healthy weight. Being overweight increases your risk of diabetes. Even losing 5 to 10% of your body weight can significantly lower your risk. 4. Regular health checkups. Regular checkups with your doctor can help catch any signs of diabetes early, making it easier to manage. 5. Avoid smoking. Smoking increases the risk of diabetes and its complications. Quitting smoking improves overall health and diabetes management. 6. Limit alcohol consumption. Drinking too much alcohol can lead to weight gain and increase the risk of diabetes.
Those are very practical tips. How widespread is diabetes, And how many people die from it each year?
Diabetes is a global health issue. According to the World Health Organization, WHO, about 422 million people worldwide have diabetes. In 2019, diabetes was the direct cause of 1.5 million deaths. Many more deaths are linked to high blood sugar and its complications, such as heart disease and stroke. In the United States alone, diabetes is the seventh leading cause of death.
Those numbers are staggering. What should someone do if they think they might have diabetes?
If you experience symptoms like frequent urination, extreme thirst, unexplained weight loss, increased hunger, fatigue, blurry vision, or slow healing sores, you should see a doctor immediately. A simple blood test can check your blood sugar levels. If diagnosed with diabetes, your doctor will create a treatment plan that may include lifestyle changes, medication, and regular blood sugar monitoring.
Can you tell us more about managing diabetes once someone is diagnosed?
Absolutely. Managing diabetes involves healthy eating. 1. Balanced diet. Focus on eating a variety of foods, including vegetables, fruits, whole grains, and lean proteins. These foods provide essential nutrients and help maintain stable blood sugar levels. 2. Portion control. Be mindful of portion sizes to avoid overeating, which can lead to high blood sugar levels. 3. Carbohydrate counting. Carbohydrates have a significant impact on blood sugar levels. Learning to count carbs and distribute them evenly throughout the day can help manage blood sugar. 4. Healthy fats. Include healthy fats like those found in avocados, nuts, and olive oil, and limit saturated and trans fats found in fried and processed foods.
Thank you for that comprehensive discussion, Dr. Jane. Let's delve a little deeper into each aspect. Can you explain more about the lifestyle changes that can help manage diabetes?
Certainly. Lifestyle changes are crucial for managing diabetes effectively. Here are some more details on what you can do. 1. Regular exercise. Types of exercise. Incorporate both aerobic exercises, like walking, cycling, or swimming, and strength training, like lifting weights or using resistance bands. Consistency. Aim for at least 150 minutes of moderate intensity aerobic exercise each week, spread out over several days. Monitoring blood sugar. Check your blood sugar before and after exercising to understand how different activities affect your levels. 2. Monitoring blood sugar levels. Frequency. Depending on your treatment plan, you might need to check your blood sugar levels several times a day. Tools. Use a glucometer to test your blood sugar levels. Some people may also use continuous glucose monitors that provide real-time data. Record keeping. Keep a log of your readings to identify patterns and adjust your diet, exercise, or medication accordingly. 3. Medications and insulin. Oral medications. There are various oral medications that help control blood sugar levels by improving insulin sensitivity, increasing insulin production, or slowing down carbohydrate absorption. Insulin therapy. People with type 1 diabetes and some with type 2 diabetes may need insulin injections or an insulin pump. It's important to follow the prescribed regimen and understand how to adjust doses based on blood sugar readings, food intake, and physical activity.
Thank you so much, Dr. Jane. Before we wrap up, do you have any final advice for our listeners?
Yes, I'd like to remind everyone that while diabetes is a serious condition, it can be managed with the right lifestyle choices and medical care. Staying active, eating well, and maintaining regular checkups with your doctor are key to living a healthy life with diabetes. Don't ignore symptoms, and seek help early if you suspect you might have diabetes.
Great advice. Thank you again, Dr. Jane, for joining us today and sharing this important information.
Thank you for having me.
And thank you to all our listeners. Stay healthy and take care. Goodbye.